Tuesday edition of the virtual media briefing about COVID-19 in London and Middlesex County. We're glad you could join us. We're also happy to be joined this afternoon by the Mayor of London, Ed Holder, the Warden of Middlesex County, Cathy Burghardt-Jesson, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Mackie, Chief Medical Officer at LHSC, Dr. Adam Dukelow. And welcome to the media this afternoon who are joining us, and I thank you to all those who have submitted questions already. We'll get to those in a few moments, but if you have not yet submitted your question, just click on the text bubble with the question mark in it here on Microsoft Teams, and if you could indicate your name, your media outlet, and who your question is directed to. And finally, a welcome to those tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners to Global News Radio, AM 980 CFPL, and those who are tuning in on the CTV London website. Let's get to our opening remarks, and we'll start this afternoon with Mayor Ed Holder.
Well, thank you, Dan, and good afternoon, everyone. I hope you all had a happy and healthy Easter and a good long weekend. I'm pleased to report that while bylaw enforcement officers were called to a number of residential gathering complaints over the long weekend in London, none were found to be in violation of the COVID protocol. I'll take that as a positive sign and hope that it bodes well for our numbers going forward. So as frustrating as it might be that along with the rest of Ontario, we find ourselves in the midst of another shutdown, I think it's important we balance disappointment with optimism whenever we can. So there is some good news to share today. As many are likely already aware, anyone in London, Middlesex born in 1956 or earlier can now register to receive a COVID vaccine. That would include your mayor as well, who just got in under the wire. You know, it's just over a week ago we announced anyone 70 or older was eligible. Well, now it's 65 plus. So we're making great progress, and vaccine distribution is really now starting to ramp up. As of just a couple of days ago, we'd administered more than 93,000 vaccines across London, Middlesex, and we're averaging more than 2,200 shots per day. Again, I know that number will rise as our supply of vaccine is increasing steadily. I will say, however, that I've reached out to the Premier to push for more vaccines for pharmacies in London. As of today, we have only 2 pharmacies providing AstraZeneca in London. Guelph has twice that many. Ingersoll has 2. St. Thomas has 2. London has 2. Hamilton has 10. The Waterloo region 18. So given our size, the fact that we have just 2 is not acceptable. It is my hope we will receive some positive news on that front in the coming days. I believe the Premier is receptive to growing the pharmacy counts, and I appreciate Minister Jeff Urich's support in growing those numbers in London. Lastly, a reminder to everyone, please, whenever you can, support local business. I stopped by a number of shops in downtown London earlier today, and they're doing everything that they can to survive over these next few weeks and months. You know, they've been there for us in the past, supporting our community events, supporting our local sports teams, and more than ever before, now, we need to be there for them. And that's especially true for local restaurants. You know, I have no idea still why they're unable to offer outdoor patio dining, but in the meantime, I'd strongly encourage all Londoners to take advantage of curbside pickup or order directly from the restaurants themselves instead of using the third-party purveyors. It would mean the world to them and keep them going through this most difficult of times. So thank you for hearing my message. I'll turn it now over, if I can, to Middlesex County's favorite warden, Warden Cathy.
Great. Well, thank you very much from the county's favorite mayor of the City of London. Thank you, Mayor Holder. I hope that this briefing does find everyone well, having enjoyed a long weekend that was celebrated appropriately and safely. My weekend consisted of receiving calls and emails from many residents and businesses across the county, confused and dismayed with the situation that we find ourselves in today. If I'm being honest, I will share their confusion with them. There certainly was some mixed messaging that was sent out from the province at the end of last week with regarding the latest shutdown that we find ourselves in. Our communities have worked incredibly hard and sacrificed so much in the last year, and yet we find ourselves in much of the same spot that we were a year ago. And I'm still trying to understand the rationale behind what is open and what is closed. But what I am confident in is what the mayor is confident in, the need to support our local small businesses as much as we are individually able to. We are so fortunate to have the variety of choice that we do. So buy a gift certificate from a personal support worker. If you are able, commit to getting takeout once a week from a local eatery. I would encourage you to shop in London for those items that cannot be readily purchased in our communities. We have many options available to us, either through local delivery or through curbside pickup. Please always choose to support local stores and services rather than impersonal online giants. As the mayor said, by supporting local, we can ensure that those businesses will still be there when we need them to continue to support our community events. With the announcement of vaccines now being open to those 65 years and older, I want to encourage Middlesex County residents to book their appointment through the Middlesex-London Health Unit's appointment booking page. It's important to note that the Middlesex-London Health Unit has also announced that pre-registration has opened for essential workers, and this includes our important agriculture community and our farm workers. So please go to the Health Unit's booking website for more information to pre-register to get those vaccines. We are fortunate to have a mass clinic in Mount Bridges, and I understand that there is frustration that there is not a clinic directly in your community. Characteristics with the vaccine, staffing levels, and many other considerations have been taken into account, and this is what we have today. I can assure you that your municipal leaders are in constant contact with the health unit to talk about and discuss how we can improve accessibility in community. But this is where we are now. It is hopeful, as we see vaccines being distributed through more pharmacies, that accessibility will improve. In Middlesex County, we are always quick to brag about our sense of responsibility, our sense of community, and our responsibility to community. So let's show that off. If you know of someone who has a transportation issue, consider arranging safe transportation for a neighbor or friend. We need to get vaccines into the arms of those that are eligible. We are all in this together, and we need to support those that may not have the resources available to them that they need. As always, remain physically distant, wash your hands. If you have COVID symptoms, get tested. Stay home. Keep your bubble tight, only go out for essential shopping, support local, wear a mask, and when you are eligible, get the vaccine. Over to you, Dr. Mackie.
Thank you very much, Madam Warden and Mr. Mayor. So I want to touch on a few things, and then I'll pass to Dr. Dukelow. First of all, the case counts over the last few days. So we had 79 cases diagnosed yesterday. That's down from our highs over the weekend, but still a very high level. What is more concerning is we had 109 variants of concerns reported yesterday. That means now there's some batching there. So those variants of concern would have applied to several previous days. Obviously, with the number being higher than the total case count today, those aren't all reflected in yesterday's cases. But that really signals a shift in what is happening in our community. The majority of those variants of concern are coming from the post-secondary age, the 18 to 22-year-old age group we identified on Friday. I want to be very clear, what we're seeing in that age group who are testing positive for COVID is not frontline essential workers who have no ability to work from home. It is really social gatherings in the young adult population. And that's been pretty consistent. We are not seeing a vulnerable group from a demographics perspective. What we're seeing is an unfortunate behavior among, as usual, a very small minority. A vast majority of students at Western, Fanshawe, even broader population of young adults are following guidelines, keeping their distance, staying home, masking, etc. But enough of a subgroup are partying, gathering in large numbers, and not following distancing and masking measures that we're seeing rapid spread there. The complete opposite picture is what's happening in schools right now, in elementary and secondary schools. While we do have cases diagnosed in elementary and secondary schools, very few of those cases have resulted, have A, been acquired in school, or B, resulted in any further spread within school. We've had cases over 100 this term, very few, really only about 8 or 9 examples where we're fairly confident that there was spread within a school. 8 or 9 cases. That's about 2.4 million student days since schools reopened mid-February. Transmission in schools is exceedingly rare in our area. That's likely the case other places as well. If you look, there was a declaration in Peel region where the Medical Officer of Health issued a Section 22 order to close schools. The situation there is incredibly different. They had way more cases and outbreaks in schools, but even in that circumstance, before their school investigation team was overwhelmed, when they were still able to investigate cases, they were not finding evidence of spread in schools. What they were finding is cases in schools because of the testing of all students that have symptoms. They were finding outbreaks where likely the transmission wasn't in the class. It was likely in the community, or even just students that happened to be in the same class when a COVID wave was coming through their neighborhood. Even in Peel, where they've made the decision to close schools, the Medical Officer of Health is clear. It doesn't mean schools are unsafe. And it really was almost a logistical issue where there were so many exposures in schools, it was hard to keep schools open because people had to be quarantined at home, but not because of spread in schools, simply because of cases that were uncovered because of school screening. I'd like to mention a related issue, and I'd ask for your help in the media to address this issue. When we talk about cases that are school cases or school outbreaks, it's really important that we recognize the students are not in the school anymore. The way some of the narratives have come out, it almost seems like you have students, dozens of students in our area that have been diagnosed with COVID that are walking the halls of school. That's simply not the case. There are, as soon as a student has symptoms, they're at home. As soon as they test positive, they're at home. And none of those COVID cases are in school, as sometimes gets into the narrative. The other side of that is the question, what about asymptomatic students? Are there lots of students in schools who don't have symptoms but do have COVID? Our testing indicates the opposite is true. The asymptomatic testing in schools in this region has identified no cases. We haven't had thousands of tests done. It's in the hundreds, but they've identified 0 cases of COVID in students that don't have symptoms in this area. The other large group that we're testing is contacts of cases in schools. So of the contacts we've had in schools, it's between 2,000 and 3,000 student or teacher contacts that have been tested since schools reopened this year. And it's only a handful have tested positive, probably on the order of 0.5%. I'm hedging a bit because we don't have the denominator precisely, but our estimates are that, of the 2,000 to 3,000 students and staff that have been tested, we know there have only been, of those close contacts, about a dozen that have tested positive. So we're talking about less than 1%, probably on the order of 0.5% or less of contacts of a confirmed case of COVID are testing positive in schools. Peel, different circumstance, 171 outbreaks in schools in Peel at the end of last week. Here we have 5 outbreaks. We've just declared one over, and they're all less than 5 students. most of them 2 or 3 students. So we've got a situation where we're not seeing evidence of spread into schools here. There's no indication that we should be closing schools here. And we also know that there's lots of evidence of harm, closure of schools. There's impacts on student learning, there's impacts on student mental health, and those impacts are disproportionately borne by the people that are already vulnerable. I want to share one other thing before I pass to Dr. Dukelow, and you heard Mayor Holder mention the numbers around the vaccination campaign here. I'll share with you a chart that we're planning to produce on a regular basis, and hopefully this gives you a sense of where we're at in the campaign. Is that coming through full screen for you?
Yes, we can see that.
Okay, super. So what you've got here is, this is our bulletin that we're producing daily, and basically we've just received permission from the province to release this sort of information. So we're going to buff and polish this and make it available on a regular basis for the media. This looks at prior day's vaccination in the top sort of rectangle here, and then our inventory forecast in the bottom rectangle. And the top, you can see that we vaccinated about 1928 people yesterday on Easter Monday. The Agriplex, 1266 people were vaccinated there. The 97% refers to the percentage of people who were booked and showed up. So we have, a certain rate of people who book and then don't end up showing up. It's pretty low. Those doses do not get wasted. So 97% there. At Mount Bridges, 99% of people who booked showed up, 280. At North London Optimist, 382. And that's for your 1928 overall. On most days, we have mobile clinics on top of that. So our number is closer to 2,200 on most days. Yesterday, there wasn't a mobile clinic in operation. Down to the bottom half here, this is our inventory forecast. So today, yesterday was April 5th, today's the 6th. We did receive a shipment of Pfizer. And you can see that by the time we get our next shipment in a little over a week, our vaccines will be down to 0. So each day we're vaccinating enough people that we get almost to 0 by the time our next shipment is expected. And that continues each week. So basically, the goal we have is to zero out each week, or as close as we can, without putting, the next day's supply. Sometimes the vaccine is delivered a day late, so without putting that supply at risk. And we're pretty much there. Moderna is the second part down here. Same thing, we haven't had as much Moderna this first shipment, but the next shipment will be a bigger shipment, April 17th, give or take, and then we'll draw those down before the next shipment after that. So you can see that, on hand we have 18,630 Pfizer, 3,800 Moderna, and we're planning to get those all into arms as quickly as possible, which we've, been able to do up till this point. So hopefully that gives you a better sense of what we've been doing on the vaccine supply and administration side of things. And of course, as we've discussed here, as soon as we have more supply, we'll be able to increase the numbers given per day and move more vaccine through. Maybe one other thing I'll mention, these capacities, as we've discussed here before, again, Agriplex can easily go to 2,000. We think maybe more at peak. They did a stress test last week that hit about 2,000 in one day. Mount Bridges, we know now we did a stress test there at 500. We believe we can do 600 there, no problem. North London Optimist will be doing a stress test there in the next week or two, and that clinic is set up for 2,000 as well. Earl Nichols would be another 2,000 when that comes on board. So that's where, when we talked about 4,500, we now believe it's about 4,600 because Mount Bridges will do a little better than we previously thought. So that's our vaccine at the mass clinics. I appreciate the warden's comments that we absolutely need to do more to get the vaccine out to people in their home communities, closer to home. Appreciate that very much. Right now, we are very much focused on the mass clinics because they're the most efficient way to use staff resources and get vaccine into arms quickly. but looking forward to diversifying in terms of pharmacies and primary care over the next week or two. Thanks, Dan, and I'll pass to Dr. Dukelow now.
Thank you very much, Dr. Mackie, Mr. Mayor, and Madam Warden. As the local and provincial COVID situation escalates, I appreciate the opportunity to join today's briefing and provide an update from London Health Sciences Centre. On a positive note, we are currently outbreak-free at LHSC. As of 3 p.m. yesterday, we were caring for a total of 25 COVID-19 inpatients, 9 of which were in critical care. As of this afternoon, that number has increased to 12 COVID-19 inpatients that are in critical care. I would like to share with you that of those 12 critical care patients, 5 are under the age of 60. Consistent with our colleagues' experiences across Ontario, we are seeing younger patients that require a higher level of care during this wave 3 versus wave 1 and wave 2. I believe everyone on the call will have seen the rapidly escalating numbers of ICU patients across the province over the past few days and week. As of this afternoon, there are more than 500 COVID ICU patients in Ontario. During wave 2, the peak was 415. I've also previously commented at this briefing that LHSC is part of a broader Ontario healthcare system. As other hospitals experience very high or full occupancy, COVID-19 patients will continue to be transferred to hospitals with more capacity to care for them, such as LHSC. 5 of our 12 COVID ICU patients are from outside of the London area, from the London area. The remaining 7 are transfers from the Greater Toronto Area and Thunder Bay. With climbing hospitalizations across the province, we anticipate receiving more ICU and ward level patients from other cities this week, as do some of our partner hospitals that surround London. More admissions from London or from other parts of the province will result in the need to open more ICU beds. Unfortunately, opening more ICU beds will likely mean decreasing surgical activity in order to staff the additional beds. This is not what we want to do, but it may be what we have to do in the coming days. If we're unable to slow the community spread of the virus locally and around the province, hospitalizations will continue to increase further stretching the acute care system to care for COVID and non-COVID patients. We must now be as vigilant as ever by limiting our social interactions, physical distancing, washing our hands, and wearing a mask when we're with others outside of our own household. Our hospital and emergency departments remain a safe place to receive care. LHSC will continue to be a dependable resource for our community despite the challenges this third wave is presenting and will present for the next number of weeks. I look forward to your questions, and thank you.
Thank you, Dr. Dukelow, Dr. Mackie, Madam Warden, and Mayor Holder. Well, we've got a lot of questions. Let's get going on them right away. The first question is for Mayor Holder and for Dr. Mackie. It's from Carrie McKee at CBC London. The Mayor of Windsor is calling on the province to adjust the vaccination framework to target frontline essential workers, such as teachers, factory workers, etc. What are your thoughts on changing the strategy given the uptick in variant cases of COVID and the increase in young people becoming infected? Dr. Mackie, you want to go first, and then we'll hear from Mayor Holder.
Sure, happy to, Dan. I think it goes without saying that we wish we had vaccine enough to vaccinate everyone, essential workers included. Right now, you're in a rob Peter to pay Paul sort of situation, and Peter is experiencing 97% of the deaths in Ontario. 97% of the deaths in Ontario are in people over the age 60. So, number one goal of any pandemic response is to prevent deaths. We should be targeting those who are at highest risk of death or those who care for them. That's what the campaign is doing right now. Those decisions happen at the provincial level. We can't change them at the local level, but we do support them because of that focus on deaths. Age-based is the way to prevent the most deaths. And again, 97% of deaths happening in people over age 60. So you'd be taking vaccine away from somebody at higher risk of death, probably 3 to 5 times higher risk of death, and giving it to people at lower risk of death. I get that, everybody deserves vaccination. There are people that because of their role are at higher risk of acquiring COVID. The focus now is on preventing deaths, and that's what this campaign and strategy does.
Dr. Mackie, Mayor Holder.
Thanks very much, Carrie. I always think it's a bit of a slippery slope when politicians start to weigh in on health matters. But I understand the frustration as indicated by the Mayor of Windsor when there's certain pressures and frustration where individuals are hoping that they can be next. I recall when the protocols first came out in terms of who was being taken care of, and the requirement to or the determination to take care of the folks in long-term care facilities, then 80 plus, 75 plus, 70 plus, 65 plus as of today. At the same time, we tried to balance that out. I think it's fair to deal with first responders and our frontline health workers, and how you find those balances is more medically determined, which I'm glad to say, than politically determined, because I would rather it be based on science than pressure. But I do understand the pressure, and I understand the sincere frustration that people feel in terms of looking to get vaccinated and wanting to get that. I concur with Dr. Mackie. If we had more doses, we'd do it that much more quickly. And as those vaccine supplies increase, I'm sure that will be the case. But we certainly support the Middlesex-London Health Unit's determination to do this in a measured, thoughtful, and on the basis of risk considerations and the potential for mortality. So I applaud them for doing that. I think that just makes a world of sense to me.
Thank you, Mr. Mayor. Follow-up question from Carrie McKee for both Dr. Mackie and Mayor Holder. What do you think the province should consider regarding paid sick days to help workers stay home if they're not feeling well? Dr. Mackie, if you want to take a first cut at that.
Sure, and our Board of Health has spoken on this as well, as has the Association of Local Public Health Agencies. Paid sick days would help people who are sick stay home when they have COVID. So it would be an additional strategy that could help, keep people isolated when they should be isolating.
Mayor Holder, anything to add?
Yeah, thanks, Carrie. Look, there are a number of organizations that currently provide paid sick leave for individuals, and not just municipal, provincial, federal organizations, but our factories and a number of companies throughout our city. With all of that, I would add that anything that encourages people to stay home when they're not well, especially during this third wave, is something generally I support. And being mindful that there are so many within the workplace that have benefits that are currently available.
Thank you very much. Our next question comes to us this afternoon from Jane Sims at the London Free Press. Dr. Mackie, it was mentioned in the health unit's media release this morning that the 65 and over age band opened up because of an increase in vaccine supply and the expansion of provincial pharmacy program. How much more supply is MLHU getting, and is it enough to get the Nichols Arena opened as a fourth mass vaccination center? Are we going to ramp up on weekends?
Yeah, thanks for the question, Jane. So the increased supply is that Moderna that you saw in the chart. We have about 11,000 coming mid-April and another 8,000 late April. That will increase our capacity, by on average over that period. Those deliveries are every 2 weeks, so it's probably about 1,000 new vaccines a day. We're still nowhere close to testing the capacity of the 3 clinics that are open. So we need to see probably that number again in order to justify opening a 4th clinic. Although we, very much hope that we are able to do that soon.
Thank you, Dr. Mackie. Let's go to our next question. And the next question is a follow-up from Jane Sims. Dr. Mackie, a couple of weeks ago, the health unit said it would be returning to long-term care and retirement homes to vaccinate anyone, residents and staff, who was missed in the first mobile campaign. When will this happen, and how many people do you anticipate need to be vaccinated in the care homes?
Yeah, so when we went in for second doses, we were able to give a number of first doses to staff and residents who hadn't been caught in the first round. Staff, of course, are eligible. I mean, once you're eligible, you remain eligible, so they can go down to the mass clinics and get their vaccines anytime. For the ongoing 1 or 2 new patients per month that are rolling into those sites, we don't yet have a perfect strategy. We are working with some of the larger homes. It's a bit easier when you've got a larger number of people coming in, but essentially we don't have that completely resolved. The positive in that situation is when almost all the residents around you and the staff that are caring for you and your essential caregivers are vaccinated, is really a ring of protection around you. And so the risk to those people is low. And that's why we're not seeing the deaths in long-term care and retirement homes in this wave. And the deaths continue in the elderly, but those that are not involved in long-term care and retirement homes.
Thank you, Dr. Mackie. The next question is from Jennifer Beeman at the Free Press. Dr. Dukelow, this one is for you. Dr. Dukelow, there are 29 COVID-19 patients in hospital at LHSC. What are their approximate ages? Is LHSC caring for younger patients now than they did in the first two waves?
Thank you very much, Jen. So I'll make similar remarks to I did in the intro, in that we do see a trend towards younger patients and younger patients being sicker, but also qualify that with a couple statements. One, we know that we vaccinated a large portion of the older population, so that will result in a proportion of higher proportion of younger patients. And also our total numbers are not high enough to say it's statistically significant, but I would say it is a very concerning trend, and we've seen it across the province that it's younger patients that are getting sicker.
Thank you, Dr. Dukelow. And Jennifer has a follow-up question for Dr. Mackie. Dr. Mackie, are you concerned that crisis-level COVID activity in parts of the GTA will prompt the province to divert doses from low and medium activity regions to hotspots? Do you feel our expected local vaccine supply in the coming weeks is stable?
Well, I appreciate the question. It's predictable. It's not perfectly stable. The number of Pfizer doses we'll be receiving in the next few weeks actually goes down a bit from around 13,000 to 11,000. But we are receiving more Moderna doses than we are losing in Pfizer doses over that time. Moderna is the one that's less predictable in terms of timing, that it's scheduled to come one day and often comes several days, sometimes even a week late. So that's something we're managing through, a bit of uncertainty there. What the province has done is they've brought the allocations back a bit. So the 13 down to 11,000 is primarily so that there is more central strategic reserve for the province so that they can redeploy places that need it. Am I concerned? No, I'm not. As we vaccinate people in Toronto, that helps protect people here. If we can end the pandemic there, that will make a tremendous difference here. We're all connected in so many ways that I don't see that as a concern.
Thank you very much. The next question is from Andrew Graham, Global News Radio AM 980 CFPL. Dr. Mackie, the province has indicated that health units that wish to switch to Ontario's vaccination booking tool will still be allowed to do so in April. Does the MLHU plan on making a switch?
At this point, we don't plan on making a switch, Andrew.
On to the next question. It's a follow-up from Andrew Graham. Dr. Mackie, how many cases are linked to the ongoing outbreaks at Western University? Are there any new cases in the Western community that are not linked to those outbreaks?
Well, thank you for that. We had promised to give an update on case counts, and I'm happy to do so here. So we do have the 6 outbreaks in different residences at Western. The Essex Hall residence outbreak has a total of 5 cases at this point. The Delaware Hall outbreak has a total of 6 cases, so those are relatively small. The Elgin Hall residence outbreak has 9 cases. The Medway Sydenham Western University residence has a total of 19 cases. Saugeen Maitland Hall has a total of 30 cases and 2 probables. Sorry, we do have a 7th. Ontario Hall residence has an outbreak of 14 cases. So across that, you can see that there are, I haven't totaled them all up, but between 50 and 100 cases. Those are essentially dwarfed by the cases outside of residence. So cases that have been cases and outbreaks that have been associated with social events off campus, post-secondary from various places have created more cases than those in residence. So, both of those are concerning trends. The other thing very concerning about those is that many of our variants of concern come from those outbreaks in the off-campus parties and the residences that are on campus. So hopefully with the change in policy at Western to encourage students to buddy up, to return home, and I don't think closure of classes will make a big difference. To be honest, we weren't seeing spread in classes, it was in the social stuff. But hopefully that is something that will make a difference in terms of our case counts here. And really encouraging students, and Western is as well, to get tested before they return to their home communities, because we don't want them spreading COVID there, and actually encouraging all students, even if they don't get tested, to quarantine when they return home.
I am on mute. There we go. Now I'm on working. Just want to mention to everybody that we are in overtime at this point. We do have a lot of questions left to get through. So if I could just ask the media to perhaps hold off asking any more questions until we get through. And I expect that your questions will probably be answered, just so we can get through as much as we can this afternoon, being mindful of Dr. Mackie and Dr. Dukelow's time. All right, next question. Sophia Rodriguez at CBC London for Dr. Mackie. Clearly cases have really taken off here and across the province. What measures would you like to see from the province in order to curb the spread of the virus? What will it take to control this?
On Friday, the Council of Ontario Medical Officers of Health, in partnership with the Association of Local Public Health Agencies, so the umbrella agencies for local public health in Ontario, issued a call for a stay-at-home order. We believe that's the next step. I'm on the board of ALPHA, Association of Local Public Health Agencies, and definitely supported that call. A stay-at-home order could bring an additional measure of distancing and of reducing close contacts that could make a big difference. We saw it being a crucial part of the lockdown shutdown in wave 2, definitely made a difference. And we're, if we're going to get a hold of this wave, we believe that will be necessary. As always, it's the government's decision, and they have to represent the values of the people that they serve. And so all we can really point out is that that would help get a hold of this pandemic wave, but there are other considerations. And I know the government has signaled some openness to that and potentially other public health measures. So hopefully we'll hear more in the next few days.
Thank you, Dr. Mackie. We're going to go to a question now for Dr. Dukelow from Andrew Graham at Global News Radio, AM 980 CFPL. Dr. Dukelow, given the latest ICU and COVID inpatient numbers, do you have any concerns about LHSC hospitals reaching capacity? At what point exactly does LHSC reach capacity?
Thanks very much, Andrew. It's a bit of a challenging question to answer in that we can flex our capacity. So I mentioned during my intro comments that in order to open more ICU beds, we would likely need to have some staff that would normally work in the perioperative area move into the ICU to open more beds there. So as a hospital or two hospitals with literally hundreds of beds, we could create capacity by slowing down scheduled activity. There's obviously a downside of doing that. We have lots of people waiting for procedures and surgery, and we don't want them to wait any longer than they absolutely have to. So sorry for the less than specific answer, but what I'll say is that we will manage through and continue to provide high quality care to whoever needs it in the moment. And then once we get through the wave, we will ramp our surgical activity back up.
Thank you, Dr. Dukelow. And I've skipped ahead a few questions. There's one from Scott Kitching at Blackburn News that I think falls in naturally here. And I know you talked about this a bit in your opening remarks, but I didn't hear the breakdown. So Scott is asking, Dr. Dukelow, can you say how many, if any, of the 12 ICU patients are from outside the London area?
Yeah, thanks very much. The number is 7 that are from outside of the London area, and they're from both the GTA and Thunder Bay.
Thank you very much. All right, next question, and going to go to Sophia Rodriguez at CBC London. Dr. Mackie, more than 120 variants were screened in the past couple of days. Why are we seeing so many of these? How quickly do these variants spread when compared to the regular strain? And also, is there a specific age group that has screened the most for variants, and if so, why?
Yeah, emerging evidence on all of that, but essentially it looks like the variants spread about 50% more quickly. It looks like they also can cause more severe disease, which wasn't at first recognized. The primary source of those variants is that 18 to 22-year-old age group associated with social gatherings that we've mentioned.
Thank you very much. Next question from Andrew Graham at Global News Radio. Dr. Mackie, are there any new details on the Parkwood Institute outbreak? Were all residents and staff vaccinated prior to the outbreak?
I don't have all of the details there for Andrew. What the staff were all eligible for vaccination at Parkwood. I don't have their uptake there. You'd need to get that probably through St. Joseph's administration. The residents, it would be a real mix. You know, the veterans wing of Parkwood, which essentially acts as a long-term care facility, all the residents were offered vaccine, but other wards that have younger populations would not have received vaccine. So a real mix there.
Thank you, Dr. Mackie. Next question is from McKinley Leonard Scott at the Middlesex Banner. Dr. Mackie, can you speak to the digital vaccination certificate that folks are finding attached to their receipt emails after receiving their shots? The province has shown some hesitancy on the idea of a vaccine passport, but is this digital certificate a proof of vaccine that could be used now or in the future for travel or access to businesses? Is it MLHE specific or a province-wide certificate?
Yeah, this is a provincial, basically a receipt. It looks like a receipt from, you know, a restaurant or a retailer, and it includes the details of your vaccine, what the lot number was, you know, which arm it was injected in, that sort of at the time, and for their first appointment, it will include on it the date of the second appointment. It's not intended as a vaccine passport, but certainly, you know, if employers are requesting that, that might be a good thing to use as evidence that you've been vaccinated.
Thank you, Dr. Mackie. Question from the Western Gazette. Ashley Gobeas is joining us. Dr. Mackie, do you have any updates on the two off-campus outbreaks? One linked to two business student parties, one linked to Greek life gatherings.
Yeah, so we have 4 off-campus outbreaks. One of them has been declared out over the large outbreak that had 49 cases in it is over. The other ones haven't yet been declared over. I'll bring the numbers up. I'm just having a bit of computer trouble at the moment, but they were in the range of 5 to 10 cases each when I looked at them last night.
All right, thank you very much. And a follow-up question from Ashley. Dr. Mackie, do you have any updates on the at least 13 cases centering on Western's facilities management staff? Can you repeat? Oh, sorry. Facilities management at Western. Sorry, lots of computer trouble here today. 13 cases is the total count there at this point. No new cases. Thank you, Dr. Mackie. Next question is from Steve Young at CTV London and News Talk 1290 CJVK. Dr. Mackie, there's a lot of talk that teachers and other frontline workers who should be vaccinated sooner than later. Are there any plans to try and fast track that in this area? Yeah, I mean, the reality is that we all should be vaccinated sooner rather than later. At this point, we're not planning to discontinue vaccinating in the group that's at highest risk of death, which is the elderly population and anyone over age 60. We're not planning to stop there and pivot to vaccinating younger groups. The next question is from Skylar McCarthy at 106.9 The X at Fanshawe College. Dr. Mackie, with vaccines being available for those 65 and over in the region, How is it critical to get as many as those people booked for appointments? How critical is it to get as many of those people booked for appointments? You referenced this on Twitter, that many appointments are still available.
Yeah, so we just opened that up this morning, and as of about 1:30, I was checking the system, lots of appointments available, certainly at North London Optimist Center. One of the things that is simply a byproduct of how the clinics are listed, North London is at the bottom of the list of 6 clinics, the 3 here and, the 3 here and the other ones in Southwestern Public Health. So people don't always scroll down to that bottom clinic. We have a lot of appointments right now at North London Optimist Center. I'm sure as the media helps get this message out to people over age 65, those will disappear quickly. But at the moment, there are still some available. As soon as it's clear that the wave of people who are keen to book in the 65 plus group has passed through and we still have appointments available, we will open up to 60 plus. I anticipate that happening within a week, if not sooner.
Thank you. The next question is for Dr. Dukelow from Jennifer Beeman. I'm just making sure it's something we haven't covered already. Dr. Dukelow, if LHSC has to add ICU capacity for COVID patients, what surgeries are at risk of postponement?
Thanks very much, Jennifer. So our perioperative leadership team is working that up as we speak. But as with previous needs to ramp down surgery or decrease surgical activity, we base it on the acuity of the surgery, how quickly it's needed, the potential outcomes of delaying that surgery. As I've said, we don't want to delay anyone's surgery because they're all important, but we do have a prioritization system based on acuity and wait times.
Thank you very much. Next question is from Ashley Goveas again at Western Gazette. Dr. Mackie, it's a question about the reporting of school outbreaks and outbreaks for Western. So the question is, why is the Middlesex-London Health Unit reporting case counts for elementary and high school outbreaks, but not for outbreaks at Western?
Yeah, the methodology for reporting in schools is standardized across the province. It makes it much easier to make sure that we're reporting properly and in comparable ways to other health units. Different health units have different approaches on the post-secondary outbreaks, and so it to us doesn't make sense to have those daily updates. That's the difference. I appreciate the question, and I'm sure the answer won't be fully satisfactory. I know you guys are always interested in those numbers, so thanks for the question, Ashley.
The next question, Dr. Mackie, is from Celine Zadorsky at CTV London. Dr. Mackie, the province has released hotspot postal codes that will be prioritized in phase 2 of the vaccine distribution plan. There are 13 public health units prioritized. Southwestern is on the list, but not MLHU. Should our region be on that list?
Yeah, thanks for the question, Celine. I've looked at the list and it's clearly data driven. What they're looking at is the postal codes with the highest rates of COVID and directing vaccine to those postal codes. We don't have any, and so the health unit postal codes are not on the list, and that makes sense to me.
And our final question this afternoon, Dr. Mackie, is from Jennifer Beeman. Do you have an update on the outbreak declared at Cargill? Do we know how many people are affected?
Yes, I do have an outbreak on that, and if my computer cooperates, I'll be able to pull that number for you, Jennifer. Just give me a moment. Too many Microsoft programs open at one time. Yeah, there it is. And now it's disappeared. I'm sorry, Jennifer, just give me a sec. Well, I know this makes for great TV. Thanks for everyone that's broadcasting this little moment. Okay. Yeah, 8 cases. 1 that has been reported verbally, but not in our system yet. So potentially 9 cases. That outbreak is also linked to a number of community cases as well that are beyond the Cargill staff.
Thank you very much, Dr. Mackie. And that does bring us to the end of our questions on this extended Tuesday edition of the COVID-19 virtual media briefing. Thank you for joining us. We will be back on Thursday afternoon at 2 p.m., and we look forward to seeing you then. Have a great rest of the day, and we'll see you on Thursday. So long for now.